The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Thank you so much for joining us this morning. My name is Jennifer Vivian. I'm the Manager of Entrepreneurial Services at the City of Brampton. And today I'm joined by my colleagues, Martin Bohl, Sector Manager of Health and Life Sciences, Food Processing and Logistics, as well as Daryl Van Moorsel, Sector Manager of Advanced Manufacturing. Thank you so much for joining us this morning for our webinar on managing COVID-19 outbreaks in the manufacturing and wholesale sectors. This session is hosted by the City of Brampton and the Region of Peel Public Health, and we will walk you through how to manage a workplace outbreak with industry case studies from Maple Leaf Foods and Peel Plastics. Before we begin, I'd like to go over a few housekeeping items to ensure we stay on track. The session is being recorded and a copy will be made available and emailed to everyone after today's presentation. There will be time at the end for Q&A. Please use the question box on your control panel to type in your question. We will do our best to ensure everyone's questions are answered. In the event we are unable to get to your question this morning, we will follow up with an email, or you can email us directly at edo@brampton.ca. I'd now like to welcome Associate Medical Officer of Health, Barry Pakes, to begin this morning's presentation. Welcome, Barry.
Hi, good morning, everyone. Thank you so much for joining us today. It's been a real pleasure to work with many of you. We have a lot of workplaces in Peel, but I've had the privilege of working with many workplaces in Peel around COVID-19 over the past couple of months. But it's especially good to interact with you sort of in advance of the need to do that because of any cases in your workplace. So it's terrific that you're all here and being really proactive and responsible and making sure that your workplaces are safe and your workers and yourself and your families are safe. I'm going to go through rather quickly over the next couple of slides. We're going to talk a little bit about the current status in Peel workplaces in Ontario in general. A little bit about the framework for moving forward that you would have heard about both in the media and in the documents that are available to you at your specific sectors, and then mostly focusing on your role in the workplace and some of the measures that you can use to control COVID-19 in your workplace, and most importantly, if something does happen, if there are challenges in your workplace, the best way that we can interact as Peel Public Health can interact with you in everyone's interests. Just a quick word about cases in Peel. I'm sure many of you are keeping track of how things are going since February. This is what's called an epidemiologic curve, and as I'm sure most of you know, we had a terrific report yesterday where we had our lowest case number since early March of 33 cases. Now, the day before it was quite a bit higher, so it does vary, but we look at that blue line there on my slide, which is the 7-day running average, and it's certainly trending downwards, and that is great news for everyone in Peel, everyone in Ontario, but it is really just an opportunity now while the cases are down to really make sure that we're prepared when or should a second wave happen. A couple of highlights that I think will be relevant to everyone here. There have been about 7,000 confirmed cases, or confirmed or probable cases, most of those confirmed. The median age, so who is getting sick, and right now the median age altogether is about 44 years. As I'll show you on the next slide, it is definitely trending downwards, and that's really important for workplaces. Perhaps the most important thing on this slide is that there have been over 3,300 workplace sites with exposures where we had to investigate, and about 800 of these have been true exposures. Now, as noted here, there's over 55,000 workplaces with employees. There's about 200,000 workplaces overall. So, there are a lot of workplaces in Peel region, and it's certainly in everyone's interest to make sure that we're all as prepared as possible for this next wave, for this next fall, because things are definitely going to be different over the next couple of months than they have been over the past few months since the pandemic began. And in particular, it's important to note, as I'm sure many of you know, that manufacturing and wholesale trade sectors are a really significant workplace site or type in our region, and a lot of our workplaces in PL are actually quite large compared to elsewhere in Ontario, and that obviously has some implications for this pandemic. Here's just a quick note on who is becoming ill in Ontario, and as you can see earlier on, mostly people over the age of 70. Certainly those are the people who are getting most sick, ending up in hospital, and many unfortunately dying of the disease. And now, if you look to the right of the slide, it really is becoming much more prominent among the working age population, and a lot of that is being driven by exposures in the workplace. And as we've hit stage 3 now, as people go back and interact in society more generally, younger age people are being affected, and that is really why we're hoping to proactively engage with you in workplaces. And of course, this is going to change somewhat again once schools open as well. So there's two big pieces of this puzzle around COVID-19 that you really need to think about, which are preventing the introduction of COVID-19 into the workplace. So making sure that your workers are well educated about what the signs and symptoms are, that you've got processes for screening your workers before they come in, and thinking about, overall, how you're going to make sure people who are potentially sick or potentially exposed don't come into your workplace. And then preventing transmission in the workplace. And there are a number of public health measures that I'm sure many of you are familiar with, and we're going to go over some of those today. But these are kind of in two separate buckets. And for both of them, the real key is communication. Communication between yourselves, whether you're in the management end or on the union end or the workers themselves. Communication amongst yourselves, communication between elements in your workplace, and of course, communication between public health and the workplaces should the need arise. So it's critically important to have a safety plan, as it is for any potential risk in your work environment. You have workplace specific risks, of course, that you're doing your best to mitigate all the time. But those related to COVID are critically important, and you need to have a plan, and things will always vary. We need to be flexible about it, but if you have some kind of structured plan, you'll certainly be in a much better position. So a couple of the questions, and these are part of the provincial questions that workplaces should all be asking themselves. How will you ensure that your workers will keep themselves safe from exposure? How are you going to screen your workforce? How will you control the risk of transmission in the workplace? What will you do if there's a potential case? And we will go over that today. And then a couple of things that you'll just need to stay tuned for as things change through the province, how you're going to manage any new risks, and how this changes the way you do your business, and a constant process of reevaluating what you're doing. Is it working? Is it not working? Are there new challenges we need to plan for? And those are things hopefully that you'll be doing consistently, but we won't be addressing those in the webinar today. So the first piece of that, how you can ensure that your workers know how to keep themselves safe. And a lot of that is about communication. So communication in all kinds of different ways, whether it be electronic communication, pep talks at the beginning of every day, which happens in some workplaces, and reminders, and of course signage. So making sure that signage is accessible to everybody in your workplaces, being really attuned to the languages that people speak. And if there are cultural differences in the way people might interpret some of the direction, it's really important to think about that as well. This communication needs to be constant, not because your workplaces have not heard about physical distancing as yet, because I'm sure they have, but really reminding everyone, including yourselves, how important it is at all times. And right now is a critically important time where all of these measures are really important to keep in place and get used to. And now that we are in a bit of a time where there's less COVID circulating around the province, we can become lax with these things, and it's really important to find ways that are specific to your business to make sure that you're able to emphasize it and recommunicate on a very regular basis. It's really important to understand that the hazards of COVID-19 are not only in the workplace itself when your workers are actually engaged in whatever it is that they are doing on the factory floor, whatever they may be doing in the workplace, at their desks or elsewhere. It actually is much more comprehensive than that. And this is something a little bit different, where you need to think about how they get to work, whether they're taking transit and carpooling, what happens in your parking lots, how far the walk is from the parking lot, and do people sort of go along one path, do they congregate in particular areas around entrances, how they prepare for their work, and change rooms, hallways, where the equipment is stored, and the amount of people interacting in those areas. And where people take breaks, whether you have recreation areas or certainly some kind of lunchroom or eating area, thinking about these places, outside of when they're doing their work, that may be places where COVID-19 may be transmitted. And of course, as well, when they're leaving work and how they work every day, really thinking very carefully about this. Apologies for going quickly, but you'll have these slides afterwards as well. Screening for COVID-19, as I mentioned at the outset, is critically important. So if you can prevent COVID-19 from coming into the workplace, you've really done, the lion's share of your work. And of course, there are many situations, a good proportion of people with COVID-19 don't have symptoms. But the critical element here is making sure that those who do have symptoms, particularly cough, fever, sore throat, but all the other symptoms that are listed as potential ones of COVID-19, even if they're, your employees or yourselves even are relatively sure, this is definitely not COVID-19, I haven't interacted with anyone, it's critically important that they stay away from the workplace. And then the other element is exposure. So if your employees or yourselves have been traveling, if you may have household exposures, most certainly if public health has informed you that you need to self-isolate, but also, prior to that, if you are unsure if you might have been exposed, to make sure that you or your workforce is staying away from the workplace, at least certainly until you're tested. And there are many factors involved there that if there is a serious concern, public health will be engaging with you. And there are many different methods, and these really need to be appropriate for your workplace. There's active or passive. Active meaning you're going out and asking your workers as they're coming in, you're potentially measuring temperatures, things like that, versus passive, where you're making sure that they're screening themselves, but you're not actively doing it when they enter. And we have found over time that it is critically important that there be some active measure of screening, even just asking people, reminding them, making it known to them that there is a screening process, so that people don't just get into the habit of, oh yeah, I'm feeling fine, I'm just going to go to work, and not recognizing or really carefully thinking to themselves what might be going on. We have seen, quite a few times, whether it's in our personal lives or at other times, you don't kind of notice that you're not feeling well sometimes until someone else asks you. And there are many ways that workplaces can do the screening, but critically important as well is motivating and supporting compliance, supporting your workers when they need to stay at home, whether because they've been exposed or whether they're having symptoms. And sick leave policies that actually promote that are critically important. We certainly have found in the past 800 workplace exposures that we've investigated, where people feel that they're not supported in the workplace and they do attend work anyway, is when challenges arise and transmission can occur. So that is critically important. And of course, it's also important that the workplace can track employees' sickness and be aware if there's a large number of people in the workplace who are ill, and making sure that those with symptoms do self-isolate and to get tested. Now, there's all kinds of give and take there in terms of personal health information that workplaces should not be collecting. But there's more guidance about that on our website, and we can certainly respond to your questions with respect to that as well. Controlling transmission in the workplace, I think this is an area where many workplaces have been working on this for some time, but it is really important to be vigilant. The purpose, of course, is to reduce the chance of transmission by changing the way you work. And sometimes that's going to be little changes, and other times that is going to be wholesale changes that require a lot of thinking through, a lot of adaptation and flexibility, and can certainly impact the workplace in many, many ways, both in the work that your employees are doing and potentially in their mental health. Examples of controls include physical distancing, as we know, separating, plexiglass or other separations when physical distancing is not possible, certainly making sure that masks are worn at all times. And every workplace is going to have a different approach to ensuring that all of these controls are adhered to at all times. Good hand hygiene and respiratory etiquette, make sure there is alcohol-based sanitizer where it needs to be. And depending on the type of workplace, periodically cleaning surfaces and objects. There are overarching frameworks for ensuring that there are control measures in the workplace, and certainly the most effective ones and the least costly ones are often working to eliminate these risks in the workplace. So that includes screening, sign up for visitors, engineering changes that can decrease risks include hand hygiene and sanitizer stations, plexiglass barriers, as we mentioned. On the next level, policies to limit the number of people in any space at one time and disinfection protocols. And the last level being masks, face shields, and other personal protective equipment as indicated. The least effective are the ones that we think of most often, those masks, the face shields, and the more effective ones tend to be the ways of preventing COVID-19 coming into the workplace, engineering changes that aren't subject to sort of individuals' daily behaviors, but rather are fixed changes in the workplace. Each one of those you'll certainly have to think about in terms of your own specific sector. And the Ministry of Labor website is terrific and has a number of resources for many different sectors, some very specific that are, if you haven't seen already, be great if you took a look at on the website, which is there's a link in this slide. If there is a potential case, it's critically important to exclude those workers immediately from the workplace, ensure that they self-isolate and complete a self-assessment tool, and contacting public health. So if there is a positive case, we will be contacting you. That can take, sometimes as little as a couple of hours and sometimes as long as a day or two, potentially, depending on when the case comes in. So it is critically important to ensure that the person who was positive self-isolates, explain to them how to do that, directing them to our resources in order to do that. Following the guidance and engaging with public health, making sure that which we will do when we are in touch with you, making sure all the infection control measures are in place. We will communicate to you what kinds of testing might be necessary for others who may be have been in contact with a positive case or some of their close contacts. It is important, and it is a legal requirement that the workplace notify the Ministry of Labor, Training Skills and Skills Development, that there has been a positive case in the workplace. While we're both sort of government agencies with responsibility to ensuring safe workplaces, we are quite separate, and there is a legal obligation to inform the Ministry of Labor. Don't have much time here. We'll go through quickly just the roles and responsibilities, which is really important to understand what we're going to be doing in local public health, the responsibilities of the employer, and of the Ministry of Labor. So certainly the employer is responsible for the health and safety of your employees and yourselves in the workplace, and taking all reasonable measures to protect your workers, and implementing the preventive measures and following provincial guidance, as well as the provincial guidance from the health sector, as well as to the Ministry of Labor, Skills Development and Training, and notifying them if you've had a positive case. Public health will be leading workplace investigations. We'll be communicating with you as regularly as either we feel or you feel is necessary, and certainly when this occurs, don't hesitate to reach out to us if you feel you need more information. Our responsibility really is to investigate cases and close contacts and make sure the workplace remains as safe as possible, both for your workers in your workplace as well as outside it. And the ministry will be investigating all occupational injury illnesses. That's their sort of mandate, and we often work with them when necessary, when there's some overlap between our roles. When is an outbreak declared? When there's two or more cases that could be reasonably acquired, and that's a pretty flexible definition. But if there are two or more cases in the workplace within a 14-day period, then we will declare an outbreak. And we will be in touch with you and let you know what that all means. Even if there's only one case, just because it isn't an outbreak doesn't mean swift action is necessary in order to prevent any further spread. How do we work through an outbreak? We first need to understand it by looking at how many cases there are, who are the close contacts, what are the dates that the cases might have worked at, and if there's any what are called epi links. So if we can sort of rack our brains to figure out how might this transmission have occurred between these two individuals or at all in the workplace. And sometimes those epi-links, as we call them, are obvious, and sometimes they're very challenging. If it all happened on one line, you can say that it's the physical proximity that happened there, but oftentimes there aren't those links, and we really need to be creative and innovative and think about where that transmission might happen. Every workplace is really different, which is one of the fun things about our role in workplace investigations. Assessing potential exposures, and these often include shared spaces, reviewing staff schedules, so making sure that all workplaces have really detailed records over, it would be best over at least 30 days of staffing schedules, so that we can go back and try to better understand how transmission may have occurred. And this includes not only your workers, but potential exposures to clients, customers, visitors, and that might include contractors, others who are coming into your workplace, or even just interacting with your workers, even if they don't come into your physical space. Public health is notified of all positive cases, so we will be notified. You may find your worker may notify you as well, and one may happen before the other. And as I mentioned, it's critically important to take action as soon as possible. One of the important elements is the period of communicability. So in other words, if you have a positive case in your workplace, when do we have, what kind of records do we have to look at? Who do we have to look at in terms of potential contacts? If it is asymptomatic, if someone has been identified as a case and they were symptomatic and that was the reason they were tested, then it's 48 hours before their symptom onset. If someone was not symptomatic, it is certainly more challenging, but we're using the 48-hour cutoff as well, so 48 hours before the test if they were asymptomatic. And what is a close contact? It's someone who had 15 minutes or more of interaction with a potential, with a case or a probable case, being less than 2 meters apart and without adequate personal protective equipment. And while cloth masks or coverings are very helpful in managing the overall pandemic from a public health perspective, a proper mask, an actual surgical mask, or not a simple cloth mask, is actually considered PPE. So thinking about that in your workplace, doesn't need to be an N95 mask, but a proper surgical mask is what would be considered protection in terms of that kind of proximity. And if that isn't present, then there's going to be a lot more contacts in your workplace who are going to need to self-isolate with the impacts on your workplace that would come with that. What triggers an investigation? So if there is a possible exposure at a workplace, then a workplace investigation will be conducted. And as I mentioned, we've had over 1,300 of those. Only 800 of those have actually turned out to be actual exposures. But we will investigate and we'll determine that, and we'll work with you in order to better understand your workplace and the practices there, as well as potential contacts and other associated exposures. I think I'm eating into other people's time now, so I'll go very quickly. Preparing for a meeting with public health. As I've mentioned, many of the things that are involved in preparing and having a plan are critically important in interacting with public health. So having plans or drawings of the workplace, potentially even photos of the workplace, the break areas, the common areas. Again, as I mentioned, having staff schedules and knowing who was in your workplace, even outside of it, and that includes clients, customers, any visitors, or any employees who may be at risk, and we'll need to be able to contact them, and making sure you have all of their contact information, as well as a very clear and updated list of all the infection control measures that you've been implementing in your workplace, and to some degree the success of those measures, or your success in implementing it, critically important. Who needs to self-isolate? So all employees who've been identified as a case need to self-isolate for 14 days. For cases, that means isolating for 14 days after symptom onset, and for asymptomatic folks, 14 days after the date of a test. And for close contacts, they need to self-isolate 14 days after their exposure. And we'll interact with you and liaise with you in terms of how testing might impact self-isolation. Peel Public Health is going to recommend testing strategies, as I mentioned, and will provide a letter. They'll potentially provide an outbreak number, which is critically important to making sure that all of the potential cases of people who've been in your work site are linked together, and that helps us understand how transmission may have occurred. And so we'll provide you a letter with that number on it, and your role will be to encourage your employees to get tested and make sure they bring that letter with that number with them. I don't want to overtake others, so I think I'm going to have to move quickly and potentially end. I'll just mention this slide. Can employees who test negative return to work? And this is something we're going to work with you on. So there's a very brief algorithm here, but there are a lot of factors that will determine whether someone can return to work. If they've had close contact, they really will need to continue self-isolating for the full 14 days. If they haven't had close contact, then depending on symptoms, they may or may not be able to return to work. And there are many factors that are at play here that we'll discuss with you if something does arise. When is an outbreak declared over? When 14 days have passed with no new cases, and 14 days after the date when outbreak measures were implemented, and certainly there have to be no further cases, and when we've determined from our public health end that the public health measures are adequate. Take-home measures here, and I apologize for going over. Peel Public Health is committed to helping businesses reduce COVID-19 in your workplaces. It's in everyone's interest, yourselves, your workplace. It's in our interest and the interest of the entire community. The provincial workplace safety plan is extremely helpful, as are the Ministry of Labour resources, which can be specific to your industry. Critically important is clear and supportive communication with your employees, with others in your management, with public health, in order to make sure that contact tracing and outbreak management occurs seamlessly and efficiently, and making sure that you're planning. So having contingency plan on how your business may operate with limited staff in the event of a workplace outbreak, and being flexible overall. So I will end it. I will end it there with a resource page that you'll have access to as part of these slides. And apologies again for taking a little long.
Thank you so much, Barry. That was a lot of really great information. We will be sharing again the recording as well as the slide deck with everyone. So if you need to refer back to any of the information that Barry presented, you'll be able to refer back to those slides. I am just going to make myself the presenter. So we're now going to get into case studies. I'd like to now introduce David Truce, General Manager at Peel Plastic Products Limited, and Diana Supa, Human Resources Manager at Peel Plastics Products Limited. I'm just going to give Diana access to perfect. So welcome, David and Diana.
Perfect, thank you very much. So just to set the stage for everybody, I'll give everybody a little bit of background on Peel Plastics. We supply packaging to the branded food, pet food, and lawn and garden markets. As such, we were deemed essential throughout the COVID pandemic. We operate 2 facilities here in Brampton, approaching 500 team members. And throughout the pandemic, we've had a total of 8 positive cases that have been identified in 2 distinct clusters. While we were identified as having 2 distinct clusters, I'm confident that we only had 1 case of internal transmission. And the feedback that we got from public health was that this discrepancy was due to the clustering of dates of positive results, and Barry touched on that a little bit in his presentation about the 14 days, where we couldn't quite identify or establish that there had been close contact between those individuals internally, and perhaps there were more obvious external vectors of transmission of those positive COVID cases. I'll come back to this difference of opinion later on, and I only use it to set the stage for how helpful Peel Public Health has been as we moved through the crisis. And Diana, you wanna?
Okay, great. So I wanted to talk about how Peel Plastics managed the outbreak. So we activated our business contingency plan in early March. We put together a COVID response team, and that team began meeting daily. During those meetings, we developed our COVID-19 procedures. So our response can be broken down into 5 categories: communication, screening, sanitization, physical distancing, and PPE. So communication was critical. We communicated quite often, and we did so early on. So everything from posters, signage, emails, memos, to shift huddles in small groups. Again, transparency was key. So if we did have a confirmed case, we made sure that the entire team was aware of all of the steps that we were taking. When it comes to screening, we administer a health screening questionnaire, and we pay sick team members to stay home. Return to work does require HR authorization, and we also have an occupational health nurse on site as well. When it comes to sanitization, we increased wipe downs and spraying of high-touch common areas with approved sanitizers, and we encouraged workstation cleaning. So at the beginning of a new shift, the team members were asked to do a thorough wipe down of their area, and we ensured that we provided time, and we set the expectation that these procedures were more important than production. When it comes to physical distancing, we reduced the workforce by 50% at each of our locations to better facilitate physical distancing learning. And this also allowed us to put in additional measures during that time frame. So while the team was getting used to the idea of staying 6 feet apart from one another, this also allowed us to put in visual markings to clearly illustrate 6 feet apart. We created additional locker and lunchroom space. We put up postage again regarding room capacity, signage in all of our common areas, staggered work shifts and breaks, conducted virtual meetings, and we also installed plexiglass dividers. In regards to PPE, we implemented a mandatory mask program in mid-April. We also provide face shields, and we added in hand wash and sanitizer stations throughout both of our facilities. So we continue to closely monitor the Government of Canada websites, Public Health Agency and WHO websites to ensure that we're up to date with the latest information, and we're always looking for ways to improve.
All right, well, we can talk about some of the things that I think that we did quite well through the pandemic, and Diana's touched on this and Barry did as well. Communication. I think right from day one, establishing what our sources of information were going to be for our employees. And I'm not sure that this has actually gotten easier or more difficult today. There's so much information floating around out there about COVID and how you can contract it and everything else. So I think being very clear with your employees about which sources of information you're going to use and act upon kind of limits some of the noise and chatter that can go on. So a lot of the communication, as Diana talked about, to what we were doing to limit the potential exposure. And then when we did have a positive case, it was our senior leadership team that would literally go and talk to every single employee in the parking or in the facility, letting them know that we had a positive case, what we were doing about it, the cleaning measures that we were going to take. And what that allowed us to do was have a touch point with every single team member so that we can get an idea of how they were dealing with the issues ahead of them. And then one of the questions that kept coming up was, and we added this to the communication loop as well, was with respect to the long-term health of the business, that we were taking these steps together and that we were going to continue to prosper and continue to provide somewhere for everybody to come and work. That was certainly top of mind for a lot of people. Through those communication opportunities, we also let everybody know that through all matters COVID, we were going to make decisions very quickly with the best information that we had at the time. But we also acknowledged that we were going to make some mistakes, and we're open to everybody's opinion about what or how we could do things better. This engagement with our workforce to develop solutions gave everybody a sense of control through a time in all of our lives where we felt like a little bit of control helped us just from a mental health perspective as well. While we would normally shut down equipment and hold town halls when communicating so much information to our team, obviously restrictions on gatherings meant that we were just not physically able to do so. So we, as Diana mentioned, we relied on written communication in various forms, but we also had smaller huddles with our frontline leadership so that they were very clear about why we had made the decisions we had, so that they could carry the message on to all team members. They also knew that they didn't need to have all the answers, but could facilitate and escalate as needed. And I think one of the keys to us keeping our numbers so low was the fact that we did pay team members whether or not they were coming into work. So certainly, while it was our priority to create a physically safe working environment, we were also very cognizant of the need for financial safety for many of our team members. If you remember at the time, there were so many lost jobs in the community and the anxiety that many people had with respect to the virus and the viability of so many businesses, we did not want symptomatic teammates coming into work and potentially spreading the virus. So HR did a great job of fielding every single call about every headache, runny nose, cough, and we just asked people to stay home, go get tested, and come back to work once the results were in. This is much easier today than it was in early days, as we're seeing that results are typically available within 48 hours as opposed to 7 days. And then I'd be remiss if I didn't mention this as well, and that is the mental health aspect of the entire pandemic. Reminding all of our team members about the support we have as an organization, acknowledging to everybody that that they could be going through some hard times, talking about it, and we also bolstered our coverage in this area for everybody as well. So when we looked at some of the things that maybe didn't go as well as others, if we could go to the next slide, there we go. While we were asking a lot of questions through our HR team about our team members in case they felt sick, I think that we should have been much more explicit about the need to share information on the health of other members in the household. There were a couple of cases where if we would have known about a sick spouse sooner, we would have taken different action, probably more conservative action. Subsequent to this, another learning, and this is, I think, in Peel region, a reality of the demographic that we're in, was a little bit of an awakening to the potential threats within multi-family households or renter-landlord households where you have multiple families living under the same roof. And that was where we encouraged all of our team members to establish a communication plan in the event that someone within that household begins to feel unwell. So and one of the other learnings from that was common spaces within households, and just acknowledging that that might be a threat vector to team members, and that they should treat those shared spaces the same way that they treated shared workstations at Peel Plastics. And if we can go to the next slide, please. Perfect. So, you know, certainly crisis management, this was baptism by fire for sure. If within your organizations you haven't done this training, you probably have at some point in the last few weeks gone through it in real life, but making sure that we push that training down to as many team members as possible would have helped us a little bit for sure. And then we also continue to look at improving our workflow. It's a daily task, and we're continuing to look at new technologies, new ways of doing things, including wearables that will encourage people to maintain that social distancing. Barry mentioned it as well. You know, we get lax over time, and today one of the constant reminders we have for people is just continue to separate and to maintain the distance. And finally, I'll circle back to my earlier comment about Peel Public Health and how they considered we had 2 internal clusters versus my belief that we had only 1. And I'll remind everybody that Peel Public Health is working in probabilities. To name but a few, the probability that an infected individual is being tested after the incubation period, and the probability that a tested individual has not produced a false negative result. Their goal is to ensure that we all minimize the potential for community spread. And as leaders of our companies, I understand that this can be frustrating not to be dealing in absolutes, but I have found it very useful to keep reminding myself that the safer answer for that, the answer is what is safer for the community at large. It's only by continuing to focus on what the best strategy is to reduce the overall impact within our community that we're ensuring the long-term health of our local economy. So with that, I hope Diane and I have been able to provide some helpful insights. I know that it's very difficult to give actionable steps to such a broad subject in this format, but if there's any way that any participants feel like we can help, please reach out to either of us with any questions. Thank you.
Thank you so much, David and Diana. I really appreciate you sharing your best practices with us. So the next case study is with Maple Leaf Foods. So I'd now like to introduce Ryan Orvis, Director of Occupational Health and Safety at Maple Leaf Foods, Inc., and Teresa Wong-Tu's Manager of Occupational Health and Safety. Welcome.
Excellent. Thank you very much. Thanks for having us here to be able to go through these topics, and which is very important, and obviously the case study here. Prior to jumping in, I would like to give a little bit of background in regards to Maple Leaf Foods prior to jumping into Brampton Poultry. So as you may be aware, you know, Maple Leaf Foods is obviously a producer here of some leading brand products such as, you know, our Maple Leaf Prime, our Natural Selections, Schneider's, and such. You know, Maple Leaf Foods employs approximately 12,500 people. We do business in North America and Asia. We're a leading protein provider for many national restaurant chains. As you would know, our headquarters is in Mississauga, Ontario. So we know that these are extraordinary times, and with this global spread of COVID-19, it has been critical that we all do what we can to help reduce the spread of this virus and get under control. We take our obligation and do our part very seriously. The health and safety and well-being of our consumers and our customers and our business partners and our community, the responsibility that we feel we have there is paramount to us. With that in mind, we've taken a number of precautionary measures across our business and our operations. Teresa's going to go through it here in a little bit in regards to some of those practices and procedures and such in which we've implemented. Some of the things, you know, our employees have been working from home wherever possible, and where it hasn't been, we've been taking additional precautions and including some and creating some workspaces and minimizing our social distancing. We've eliminated in-person meetings as best as possible, unless it's absolutely required. But then we would have measures in place for that, but we are leveraging our technology to facilitate as much as possible. We've restricted visitors to our offices, our sites. We're foregoing any in-person meetings with our customers or suppliers. again, unless it's critical and those processes, tight processes that we have established are to be followed. And we had prohibited all business travel. If team members of a household are traveling internationally, on a personal level, we ask them to report to the supervisors in our human resources department so that the quarantine policies can be properly applied. So, respecting our families, but of course staying close at the same time. And we will continue to work very closely with all of our partners in this situation, as we all know was and is and will continue to be extremely fluid. So we'll continue to engage through our contingency planning. We recognize that our food products are essential in nourishing our people. We are committed to continuing to execute our business with excellence, maintaining our operational stability and the health and safety of our people. So we're to continue to take steps to mitigate the risk of the spread with the virus, not just within our workplace, but within our communities. So, just really wanted to share that piece. And with that, I'm going to pass it over to Teresa so she can give some background on the Brampton facility, and then we can walk into some of the controls that we've implemented. So, Teresa.
Thank you very much, Ryan. Good morning, everybody. So this facility is the Brampton Poultry site of Maple Leaf Foods. It's a chicken processing plant, and in terms of the number of employees, it's about 312 employees. That includes 27 salaried employees. And we had our first positive, this was back in April the 6th, and over April 6th until the end of April, when we had our last positive, there were 28. In terms of the square footage, in the previous slide, I may have saw a little picture there. That's the Brampton Poultry site. It's about 44,000 square feet. And we did put a lot of different measures in place, in which I will go through now. There were a lot of significant costs associated with this. So here on this slide, you'll see different initiatives that we put in place. So just going back a little history then with regards to what had happened. So on actually April 6th was our first positive, and then April 7th, Maple Leaf Foods, we decided to temporarily suspend operations in that Brampton Poultry site. And so it was out of an abundance of caution. We were completing our investigation. We had 3 cases that first couple of days. And we want to make sure that we, make sure that our people are safe, because that's our first priority. So we did begin operations after additional protocols were put in place. We had the day shift resume later the following week. That was on April 16th, and then the afternoon shifts started on the Monday, April the 20th. So during that time, we actually developed different things, detailed communication plan for all of our employees before resuming production, and we outlined additional changes in the protocols that were initially rolled out in March, and we just made further modifications, such as like temperature checks, screening, distancing, and we also worked with a cross-functional team across the organization for support. All employees, while they were off that short time period, were called to advise them of the many changes that had occurred within a short period of time. And the Brampton Poultry team, they set up initial and regular, small social distancing town halls, discussions in the plant, and that allowed salaried and hourly employees to ask questions and get the facts. There were updated COVID-19 information posters and or on monitors in the cafeterias and the main office areas. So different other initiatives, screening, including temperature checks, they were actually started in March, and then we installed operationalized thermal scanning equipment and defined the process. We also have a few, actually, a 40-foot trailer, so you see pictures there on the right there. They were added, so entrance next to the guard shack, and we would perform temperature checks. And so you can see those are sort of similar to construction trailers there. We also did more detailed daily screening of all personnel, so that's employees, and if there were any external essential workers on site, and then we would do those screening before granting access to the facility. Face protection was mandatory, and so basically face protection before leaving your vehicle in the parking lot, throughout the day on our premises. Social distancing, we had visual aids to show the 6 feet spacing in hallways, locker rooms. You can see some of those in the pictures there. We had lines painted on the floors, and there was this continuous supervision of those areas. There also have been controlled overlap between shifts. Designated spaced out smoking areas, lines were added on floors to restrict access to one person in the box when using the cafeteria appliances. And we had various items that were moved from previous high traffic areas to allow for distancing. For example, additional punch clocks were purchased and installed in areas, and new hand wash stations were installed to allow for social distancing. We had plexiglass barriers installed on the production floor for most of our workstations. And the team, continued to enforce social distancing in all areas, especially those high traffic points, lunchroom, hallways, locker rooms, punch clock areas, etc. Other controls that were put in place, so if there were any non-Maple Leaf essential workers on site, there was only restricted access. Change room protocols were put in place. There also was regulation of the number of employees permitted in the change room at one time, and staggered breaks, increased number of break rooms, that was also implemented. The boardroom was repurposed for breaks and lunch, and we had plexiglass dividers also installed with restricted seating. In terms of touch points, we try to reduce those. So, for example, loops on doors were installed so that employees can open them with their arm or elbow instead of their hands. We also had numerous and additional hand sanitizing stations added throughout the facility. Entrances to screen trailer, the building, production entrances, all different places. We also enforced good manufacturing practices and increased our general hand washing. So we had posters in place to remind employees of that, and social distancing requirements as well. We had increased our deep cleaning. So, for example, we had hired 4 additional cleaners for welfare areas. Cleaning was being done every 2 hours, as well as between breaks and lunches. There was also increased telephone contacts with employees who were at home to follow up on absences. Additional cameras were installed to help assist with contact tracing and ongoing monitoring, and enforcing employees during breaks and lunches. And even paper pay stubs were eliminated, and we moved to electronic pay stubs. We also had something we called the COVID-19 compliance leaders, and they would conduct screening, monitoring, for example, during breaks and lunches, and disinfection of common touch points in the production areas, including like in the production areas like the computer displays, the touch screens, scanners, all that stuff was also being monitored as well, and deep cleaned. So we will continue to monitor developments, and we'll further adapt our policies, procedures, practices as new information becomes available. And we keep our employees informed. We created even online resource center on our intranet where employees can access important information about COVID-19, our company status, and key priorities. Okay, so on the next slide, I'm going to pass it back to Ryan Orvis.
Thanks very much, Teresa. So, taking a look at, what went well. So initially, we did get to work on our pandemic playbook, and Teresa outlined and went through a lot of, what those elements and protocols are within the playbook. So, mentioned around our screening and our temperature checks, and, the mandatory face protection and communications. It was all developed within our playbook. The compliance around social distancing, the deep cleaning of the facility, and just the periodic continual disinfection obviously is another key element. And the investigation. So when we did have the positives, utilizing a risk assessment tool and a team behind that to properly investigate and do the proper tracing. It was also something that, not was just within the playbook, but something that, outside of that, all the tools and all the rigor around that, feel that it's a very good process. And obviously, importantly, collaboration with our external partners in public health and our Canadian Food Inspection Agency, and as well as collaborating effort within many of our groups. As I mentioned, those other functional groups would be part of the investigation team to make sure that, not only do we just have more eyes and hands on it and but just, those other sets of eyes and perspective, as we're going through that. So, we feel that our playbook and, our all the procedures that are within the playbook is something that's been very well for Maple Leaf. So on, on the went well, on the next slide, or, even, where I would go is, or sorry, rather, what did not go well is, obviously there's always going to be learnings and opportunities. And, although having the playbook and everything behind it, as we know, the fluidity of what COVID-19 is and through the pandemic, it's just real important that, we stay on it, keep it updated. And with those updates, obviously are just the constant reissuing of revisions and communication around it, and any additions that need to be added into it based on current information and new information that comes in. And then just the other thing that was challenging, and which has gotten better now, and I think we could all probably have shared this, is just the delay in receiving various items due to the demand. In the earlier days, everyone was trying to get the sanitizers and the masks and the thermal imaging and the plexiglass, and we were all as as a country, really just working towards the same thing. And that was a challenge, was trying to get those items, but we worked through it. And as Teresa had reported there, we've got a lot of that in place. So on just rounding it off here on the last slide, just kind of going through what we'll do differently. So obviously talking about the constant upkeep of the playbook, but included in that is the communication script. So we feel we're communicating well across the network, but just having those scripts or those templates of the scripts readily available for our sites in the event of any needed communication around activity or cases or such. And then tabletops, we've conducted multiple tabletops across our company as well as within the Brampton facility. But if you could go back and take a look, that may have been something that we would have executed off a little earlier. But happy to report now that we've done multiple, and as well as completing these across, we've been including and engaging our hourly workforce in those tabletops and our site floor leadership team, such as our stewards and our Joint Occupational Health Safety Committee reps and such. So that takes us through the case study for Maple Leaf Foods. It looks like we've got a minute left here, but I just, again, on behalf of Teresa and myself, want to thank you for having us attend here today. So I'll pass it back over. Thank you.
Thank you so much, David and Teresa. We'll now open the floor to questions. There is a question panel on your control panel. If you'd like, you can type in your questions there, and we will have all the panelists available to respond. Just give it a moment for the questions to come in. It looks like we have a question from Miriam. Are masks and shields mandatory to be worn in childcare when screening is being conducted? Ministry was in yesterday and wanted us to follow up with public health to get clarification. So I guess this would be a question for Barry.
Yes, if you're going to be within 2 meters of someone, then masks are certainly mandatory and just a good idea for safety overall. With respect to face shields, the issue there is if you've got children below a certain age, and people can differ on what this age might be, but there may be fluids shared, I think we can all agree that probably 2 or 3-year-olds it's going to be a bit of an issue with. 4 or 5-year-olds it's hard to know, but generally in the what I've been advising people is sort of below the elementary level, that folks certainly are going to be within 2 meters before screening has occurred, or the people who are doing screening should be wearing the masks and face shields. And that's going to vary a little bit on site, but on exactly what you're doing in the context and where you are. But I think that's probably the best advice.
Thank you. We have another question from Dorina. When you have to self-isolate, is that considered sick time? I don't know if anyone's policies around how you manage that when someone is needs to self-isolate.
I think that comes down to company policy and or organizational policy and what different organizations have set as their standards.
Agreed. Hopefully that answers your question, Dorina. Check with your employer.
Yeah, unfortunately, they're just, I think it's understandable that that specific element is not included in provincial labor law, and both companies and legal experts sort of differ on that. But for the time being, it certainly is within the purview of each specific company to figure out what makes sense for them and the legal opinion that they get.
Great. We have another question from Patrick. Are masks mandatory in manufacturing and office spaces?
It is at Maple Leaf Foods. We have it mandatory as soon as you actually get out of your car. We have masks. That's mandatory.
Great, thank you.
In any indoor space where you're not able to distance appropriately, masks are certainly necessary. Now, there are some situations where you're in a workplace where everybody is in their own office or very well-defined cubicles, and from a safety perspective, people pulling down their masks when they're absolutely alone in one of those cubicles is not unreasonable. But certainly anytime they would exit their cubicle, it's definitely necessary to wear a mask when there's any possibility of interacting with anyone else.
Great, thank you. This is actually a two-part question. So the second part of the question from Patrick is, are there third-party companies that can come in and assess your facility to make recommendations or help you in developing policies?
Just seeing if Peel Plastics or Maple Leaf were aware of any. We haven't been formally in touch with any third-party organizations like this, but I do know that they are out there. I know that there are some companies that have contacted us at Peel and other health units in Ontario in helping out companies with either policies and procedures or workplace structures or even with respect to testing. So I know those companies are out there. I cannot certainly vouch for any that I am familiar with that are good, and I would not do that. And I don't know that any out there have a great deal of experience, but I'm fairly certain that there are some options out there in the private sector. But we are here to help you answer some of the critical questions that you have. We don't have the capacity certainly to go into every workplace and look at your workplace and help you make sure that things are your policies or your structure of your workplace is optimal. We just don't have the capacity to do that, but hopefully our guidance provides enough direction for you to at least start that process and continual quality improvement kind of thing. But there are companies I think that are out there. I don't know how to reach them.
And just to add to that, Patrick, perhaps we can follow up offline. The Brampton Economic Development Office should be able to pull maybe a list from our business directory of health and safety consultants, HR consultants that might have the ability to support you with this. We have another question that's come in from Matt. Are there any companies using rapid COVID testing on site in Peel region?
So I'll grab that one again unless anybody wants to jump in. So rapid COVID testing is something that I'm sure you've heard of in the media and is being done in other countries, and in particular, obviously, the United States. It is something that we do have in Canada here in very specific situations within hospitals and in an experimental basis as well. But the validity, in other words, whether those tests are good enough at determining who is infected and not is really it's not well established right now, even though these have been around for quite some time. So there may be private companies who are offering this kind of service here and there, but they are not authorized to do so. A rapid test has not been approved by the necessary approval mechanisms in Canada, and as such, we'd certainly not be recommending it. And I think our turnaround times are pretty good in Peel, sometimes as low as a day and a half, and up to 3 or 4 days potentially, but they're generally pretty good, and they're improving all the time. And that's the main means of testing through our assessment centers. There are specific situations in which we can access mobile testing, but the assessment centers are the main route, and I would be very leery of anyone who is offering testing services that used a different method.
Great, thank you. It doesn't look like there's any additional questions, so I guess we will wrap up here. I know we're a little over time, but the information that was shared today was so important. Lots of great information. We will be sharing the slide deck with everyone who was on the call this morning, as well as we'll be sharing a link to access the recording of this morning's session. If you have any questions, you can reach out to Peel Public Health Call Center at the number on the screen, 905-799-7700, or you can email the Economic Development Office at edo@brampton.ca. We'd be happy to redirect your question if we're not the right ones to answer, or help you find the answers that you need. So thank you again, everyone, for joining us this morning. We hope this session was helpful in understanding how to manage a potential workplace outbreak. I just want to send a special thanks to the Region of Peel, Peel Plastics, and Maple Leaf Foods for sharing your time and best practices with everyone on the call today. And thank you again for joining us. I hope you all have a great day, and feel free to reach out if there's anything we can do to further assist you. Thanks, everyone.
Thank you, everyone. Bye-bye.
Bye, thank you.